So we're here at the Biohackers World Conference. I'm Jenny, also known as Biohacker Blondie, and here I am interviewing the amazing Dr. Sogol. So you are just so knowledgeable in all things functional and also longevity. We're gonna get all into longevity, so I'm so excited. So thank you for coming on and letting me interview you. So if you wanna just kind of say a little bit about your background and then a little bit of what longevity is and aging.
Hi, I'm Dr. Sogol Ash. I'm a functional medicine doctor and the longevity director for ConciergeMD. So longevity to me is really first, I always like to think about longevity as you need to know how you're aging and why you're aging, in order to extend your lifespan and your health span. And I think of longevity as a mix of lifespan and health span. So not just extending the amount of years you live, but the quality of those years is really, for me, what I think about when I think about longevity.
For sure. It's like people need to be living a good life today, and then also extending their life is so important. So both of those factors.
Exactly.
So what do you think, what are the key factors that you think are causing aging?
Great question. I think there's
a lot.
There's a lot, but there's definitely some hallmarks.
Yeah.
So I like to think of oxidative stress and inflammation. An easy way to think about it is just stress on the cells, stress on the body. So when you have that, you get these cells that don't look like a healthy cell, and free radicals start attacking your cells. Inflammation, we know, causes aging, it's at the root of all chronic illness.
Yeah.
Another thing for me is mitochondrial dysfunction. We have mitochondria, right, in all our cells. They're like our battery source, our power source. So if your mitochondria are not working properly, you're aging much faster than you should be.
And what do you think is hindering our mitochondrial dysfunction?
A lot of things. Toxins are a big one. I see toxins like pesticides, heavy metals, mold.
Yeah.
They really affect our mitochondria. Even just stress, mental stress, physical stress, even exercise affects our mitochondria.
Yeah.
And our body rebuilds, but if your body's exhausted, it's not going to rebuild the way it should be.
It's so important. So what do you suggest some people, because there's the detoxing, getting toxins out of our body to extend our longevity and for overall health. What do you think is a kind of a good beginner guide to detox?
Great question. I'm so glad you asked this because people call me all the time saying, oh, I started this detox that they found online and they feel terrible. So I don't recommend people just detoxing, doing these things they find online because it can be dangerous. Detox can be really heavy on the body. I always say try to work with a doctor if you can because we don't know what's going on in everyone's individual bodies. An easy way though is, trying a sauna. Just sweating. That's one of our main forms of detox.
Favorite.
Right? Just get in the sauna, try to, and start your timer once you start sweating, not once you get in. Minimum 15, 20 minutes of sweating a couple times a week if you can. One of the easiest ways to start detoxing. And just taking gentle liver support. So a little bit of milk thistle, a little bit of NAC. But again, I always recommend talking to a doctor because some people, if they have a really big toxic burden, you really need to personalize the detox for them.
Yeah, I know. It's not some simple parasite cleanse or one little thing. It's like a combination. It's to do it correctly, making sure all your organs are functioning, detoxing correctly. And then of course I love the sauna. So also since you're in functional, I'm a big candidate also of blood work. So I'm sure you are as well, as to extend your longevity. So what is your typical, maybe we'll talk about some deficiencies really quick.
Yeah, so blood, I agree with you. I always say you test, don't guess. You should really know your biomarkers and know what's going on in your body. Some of the biggest deficiencies I see, I think of course we all now know vitamin D is a big deficiency I see in people, but I'm seeing a lot of iron deficiency now. A lot of people either they're not getting enough iron or their bodies aren't absorbing it and storing it properly, and that's a big reason why people are tired today.
Yeah, do you see that mostly in women? I know that's a big factor.
More in women, but I'm seeing it in men now too.
Wow, interesting.
Very interesting, and I was actually noticing I've had to put a lot more people on iron support. Recently.
And what do you recommend? Because I've had low iron in the past. Do liquid, stuff pill form?
Yeah, liquid is a bit easier on the digestive system. I like to do one called Ferrazorb from Thorne. It's has vitamin C in it. Whatever kind of iron you take it with vitamin C so that it absorbs easier. It won't make you constipated that way.
Yeah, that's such a good little hack.
But another deficiency is testosterone. It's probably like one of the biggest deficiencies I'm seeing today.
It's like half of what it used to be. So it's so like, and most men are not thinking about this. I don't know if you're also talking about women, but
more men.
Mostly men. And it's something, I don't know, what are factors, because this is probably a big topic that men want to know, is that can help them increase their testosterone.
Yeah, well, first I always recommend finding out why the testosterone is even low.
Yeah.
Right? Because a healthy sleep is a big one. Sleep. Toxins are another one, right? Endocrine disruptors, like even your personal care products, drinking tap water. Like I get men low testosterone, they're drinking plastic water bottles every day. I'm like, well, of course your testosterone
or have
low.
those fragrances plugged in the outlets, and I'm like, why? This is like destroying your hormones.
Exactly. So there's all these hormone disruptors in their everyday life that they just don't know about, and then they're like, why is my testosterone low? I
know. And the best thing with like blood work and lab work is that you can retest and see if what you're doing is working. It's the best. So I'm just such a candidate. So, and then also there's so much with longevity and biohacking, and I know you're a fan of NR and Niagen. So can you talk a little bit about that, how that helps with our mitochondria and cellular health?
Absolutely, yeah. So NR is a precursor to NAD. And NAD is a coenzyme that our mitochondria need to make energy. And as we age, we hit middle age, our NAD depletes by 50%. And yeah, that's a crazy number. Once you hit 30, it starts to deplete. And then I like we just said, NAD is kind of like our battery source, like our power source. So NR helps replete those NAD levels in a really like safe and gentle way. Taking NAD on its own, like in an IV injection, can be harder for the body to absorb or to accept. Often people will get an inflammatory response from doing a big NAD IV. NR, which, Niagen's IV, I think they're the only ones doing it. The Niagen IV will really safely help elevate your NAD levels. You do an IV and within a couple hours, it increases 20%, your NAD. And your body just accepts it much easier.
Yeah, so you're also a kind of supplementation as well. So do you take that daily? Are you okay?
Sometimes I forget, I admit, but I usually take the oral Niagen, the Pro. I take the 1,000 milligram because I've tested my mitochondria. I tested my mitochondria recently. Like I did a Dutch test, and I saw that my mitochondria needed help. Like I've just been like overworking.
I know.
So I've been focusing on it.
Was this the me screen?
I did a Dutch test.
Oh, the Dutch. Okay, not the mitochondria.
When you do an organic acid test, part of it, it'll look at like neurotransmitters, your mitochondrial health. So it's really amazing. That's another part. You can literally test anything now.
I know, it's great. I think this is the future of health, is like being able to have access to as many tests as you can and really personalizing your own health. It's so important. So also you talked about recently on the panel, just about an hour ago, but you talked about senolytics. So can you talk about that for longevity?
Yeah, so senolytics, so as we age, we get these zombie cells. So they're metabolically active and they're dividing. They stop dividing, but they're active. So they're just hanging out in this zombie state, and they kind of can spoil the whole neighborhood. They can affect the cells around them and damage them. So senolytics like Fisetin and quercetin actually kill off those zombie cells, which are incredible. And it's plants, it's antioxidants are isolated from plants, which is amazing. It's just like basic things that we already have. Like Fisetin comes like mostly from strawberries.
No, it's so important. I think too, people have to realize like you're getting older, you have more buildup of toxins, you're not able to detox as much, so you have this buildup, and it's harder to get rid of those zombie cells. It's harder to get, things get dysregulated the older you get. So it's super important to add those pieces in.
Yeah, and they're simple. They're easy ways to add them in. As long as I would always say, just try to take the right dosage. It's not like you could just eat like all these strawberries every day and it's going to give you the right amount of Fisetin to like kill all the zombie cells. So you can get it from diet, but I also say try to supplement like target the supplementation based on what's going on in your body.
Yeah, super. And then also we'll get, just because this is a hot topic, peptides.
Yeah. So my favorite topic.
Everyone wants to know all the information about peptides. So what are your, I guess, there's different ones, you know, immunity and all this. So what are your go-tos for longevity?
BPC 157. I think is one of like the easiest, safest peptides to use. You can take it orally, you can inject it. I think it's more of like one of those universal peptides that will just kind of help everything.
Like heal. It's like the Wolverine peptide.
Exactly. Yeah. It's regenerative. Exactly. It's regenerative. It can also help with your gut health a lot. I also like thymosin beta-4, thymosin alpha-1, the immune peptides.
Yeah.
To really help regulate the immune system, because I've been seeing people's immune systems kind of really, like, there's a lot of inflammation. The peptides will also help bring that down too.
Yeah, they're so great. It's like healing, immune, there's skin, there's just like everything.
Everything.
So
there's a peptide for everything.
Yeah, so that's a big one in the biohacking space. So where do you see health and longevity kind of in the future going? Especially even like with AI, it's so beneficial because we're able to grab so much more data and help with the longevity and our knowledge.
For sure. So I think we're already seeing this trend towards personalized medicine, right? Like more root cause medicine, understanding what you're dealing with and why, rather than just, you know, suppressing. I think AI is helpful in the sense that it's taking people in the right direction. You can do a lot of these labs now. The AI will kind of tell you based on your labs what it recommends. But I said this in a recent interview too. I said, nothing will compare though to your doctor listening to you, right? Compared to AI, like the AI doesn't know what you're dealing with.
Yeah.
Right?
Lifestyle, habits, everything.
Exactly. Mindset, emotionally, even I guess it could factor in medications, but you know, sometimes I compare, you know, I see patients who will put their results before I can read them into ChatGPT. And they'll tell me like, you know, they'll show me and I'm like, yeah, this is great. Like this makes sense. But often I do tweak it or change it up a bit based on what the patient's telling me and also what they're willing to do. You have to meet people where they're at.
Yeah, I know. And their stage, their lifestyle, their age, all those factors come into play, and like what they're willing to do based off of their mindset. Like what is holding them back? What is, you know, from these habits or something that they can't really get to their ultimate like health and lifespan, you know?
Exactly.
So, and then what are, you know, I know this is a boring topic, but the foundation of health, I know, like, do you tell patients, hey, maybe get more sleep or, you know, eat only whole foods? Like, what is your strategy working with patients for that?
Absolutely. I call those the non-negotiables
I love that.
of longevity. Yes. Because, and I said this, like, you can take the peptides, you can take the NAD, but if you're not, you know, focusing on the foundations of health, you're not getting really the best benefit from what you're taking.
Yeah.
You know? And sleep is one of the biggest things. Obviously, like when it comes to food, I have to play around depending on who the patient is. Some people I can, you know, tell them like, hey, follow this anti-inflammatory diet, and right away they start shifting. Other people, I ask them to take one thing out. Like, let's just start with gluten, right? If they've been eating this diet their whole lives, I don't expect people to shift overnight, but I'll start with one or two things. And over time though, within like 6 months or a year, you see radically their like whole diet has changed.
That's so great. Yeah, little by little. And then getting rid of all that processed food is just life-saving.
Exactly. And they stop craving it. They're like, I don't even want it anymore.
It's all just craving and the habits. And it's like once you get out of that cycle, you ask yourself, why was I doing that? You know?
Exactly. Yeah, but like we don't know better until we know better.
I know. What are your sleep hacks? Because a lot of people, I feel like, you know, I just did an interview as well, kind of all around sleep, and it seems, you know, it's the core for our hormones. It's the core for longevity. It's the core for our immune system. So what do you suggest someone maybe struggling with sleep? Is there like a supplement? Is there something that you know, feel like helps best?
Yeah, again, depends on the person. Magnesium threonate I really like, or a blend of magnesium, like Magnesium Breakthrough can help people.
That's great.
I also like phosphatidylserine to help bring down cortisol at night. A lot of the reason people can't sleep is like their cortisol pattern is off.
Yeah.
And they're making so much cortisol at night and they're wired. Yeah. Yeah, so phosphatidylserine, magnesium, those are 2 ways to really help bring down and suppress the cortisol at night.
Oh my God.
What else do I like?
There's so many.
There's so many.
I know, it's hard.
Yeah.
I feel like sleep is what people try to get, like, you know, do the least of.
Which is, it's funny because you need the most of, because you're like, you know, you're making your hormones at night, you're detoxing at night.
I know.
You're not getting sleep, you're just aging yourself so much faster.
I know. So this is so, there's so many things we can discuss with longevity. And I think like the foundation of health and then all the biohacks. So since this is, you know, the Biohackers World Conference, what are your like top 3 biohacks that you want to
I think my top 3, I would say NR, definitely.
Okay, me too.
Because we cycle through NAD, like our mitochondria just keep using it. So for sure NR, take some sort of liver support binder, something to help detox the body consistently. And then choose a peptide, you know, like BPC, you know, BPC, thymosin, whatever it is. I think for me, those are my top 3.
I love that so much. This is so great. So everyone, go check out Dr. Sogol at ConciergeMD, and she's so amazing, and you have a whole program, so I'm so grateful to be interviewing here.
Same here.
So thank you so much.
Thank you, Jenny.
All right, and if you have not yet been to Biohackers World, guess what? We're coming to Chicago in July and Miami in November. You absolutely want to be there. These events are unlike anything else, and I've never even seen a longevity and health optimization conference in Chicago. So I'm so excited to see all of you in Chicago at Biohackers World.